Hello, and welcome to this episode of the Reset Podcast. I'm your host, Lauren Mignot, CEO of the Cultural Communications Agency, The Flash. Each episode, I bring on a different business leader who's doing some incredible work. And this episode is no different. I am so excited to have Joe Agoada, who's the CEO of Sostento. They are literally on the ground right now, helping get people vaccinated at this time when we need it now more than ever. And we're going to hear his story about how he came to be doing this and so much more. It's going to be a great conversation. Take a listen. Hey, Joe.
Hi, Laura. Thrilled to be here.
I'm psyched to have you here. So as we were chatting, you did your homework. You know what the first question is going to be. So we're going to dive right on in. So Joe, what was your first job?
So I'm going to consider this question in terms of my career in public health, which has focused all on working to stop outbreaks and respond to public health emergencies. And so my first job then goes back to 2007 in a area of Uganda, East Africa called Kigezi, which is on the border with Rwanda. It is a lush place. It is green. Some people go, oh, Africa isn't like deserty. No, it was green, it was hilly, and actually it would get really cold at night. And my job when I was there was to help get people in the community access to HIV tests. And my first
How did you find yourself there? Just out of curiosity.
So I actually had studied undergraduate. I did an exchange program with Makerere University in Kampala, Uganda. A lot of my kind of fellow peers were going to Spain and Italy, and I wanted something with purpose. So I had an advisor and I said, look, I really want a study abroad experience, but I want it to be meaningful. I said, well, you know, there's this pre-med program, Joe. You're communications, you're not pre-med, but they go to Uganda and they study public health. So in typical fashion of me, I went to the program. I convinced them I would go and help document the trip, and I would look at public health communications. And so that really started me down my kind of experience of working in public health on different kinds of, urgent issues around the world. So that was actually how I got into this first job experience. Was I had met people during my exchange program there. And when I graduated, I got to go back and do this community outreach work.
Wow. It sounds like you're someone who actually walks in purpose from the very beginning. All right. So you have that as your first job. And now we're at Sostento. How does it all happen?
Sure. So like I said, throughout my career, I've worked on HIV in East Africa. I was also part of the Ebola response there. I worked on avian flu in Cambodia, dengue fever and Zika in Brazil. And throughout that work, I was just inspired by what technology and empowering community health workers could do. And after 15 years of that work all around the world, I had a calling to actually come back and focus here at home. I got an opportunity to learn more about the opioid crisis and what was going on in our communities here in the United States. I learned that in my own backyard where I live here in Essex County, New Jersey, that we had the highest overdose rate death in our state, and I had no idea. So I came to start talking to health workers. I actually ran a workshop with the CDC with health workers from West Virginia, Ohio, New Hampshire, and Kentucky, some of the hardest hit areas. And during that work, I realized that there was this universal healthcare worker need, that if it was Africa, Asia, and even the United States, the health workers were overwhelmed, they didn't have the right technology, they had way too much paperwork, and they just needed more support. And so I was inspired by that. And so I left my international work and started up Sostento to focus on the opioid crisis. And we were founded in 2019. And Sostento, it's an Italian word that means to uplift, nourish, and sustain. And we set our mission to support the frontline public health workers in ways that would allow them to save more lives. And we got going with that work in West Virginia. In 2019, we applied for our 501c3 in November, I think, of 2019. And we had a fiscal sponsor. We started doing our work on the opioid crisis. And then our lawyers told us that it would take about a year to get our 501c3 status. And the craziest thing happened. February 2020, we get a call, your 501c3 came in. We have no idea how this happened, but it's been approved. That month, we started our work on the COVID-19 pandemic. And so the organization has just really grown and blossomed, of course, over the last 18 months. But I was really able to bring in my work. I've run events around the world on how to do early detection and early response on outbreaks. I had colleagues around the world. So yeah, that's a little bit about Sostento and how we got started. And again, as you mentioned in the beginning, right now we're really focused on those vaccinations in underserved areas.
Wow. I mean, you just like seem to like make it happen. So what's been happening on the ground with vaccinations now? Like what are you like, how has it been so far?
So we're Sostento right now, we're really obsessed with one group of individuals that a lot of folks may not know exist, but they're actually people who are unvaccinated, but willing to get a vaccine. And they haven't gotten vaccinated, not because they're against it, but because either they have some information that they haven't kind of worked through, they have some hesitancies, or they're actually logistical barriers for them to get vaccinated. And we're working with these groups around the country. And I think most of the media attention right now goes to the anti-vaxxers when they're like, oh, people haven't been vaccinated yet. There's probably a vaccination on every corner. They must be anti-vaxxers. But I don't want to talk about the anti-vaxxers. I actually don't think we need them to end the pandemic. And actually, if we talk about them and we raise their profile up, then we're giving them service. So I put them aside, and at Sostento, we are focused on these populations. A lot of them are ethnic and racial minorities in underserved communities. There's also economically depressed areas in some of the rural communities. We're mostly working in the South and the Midwest, and we are identifying who are these unvaccinated but willing individuals. And we are working with an incredible network of free and charitable clinics to get the work done, to get these individuals the support that they need to overcome their hesitancies, to overcome their logistical barriers and get vaccinated. So that is the work that we are focused on right now.
Awesome. And can we just like talk about why it's so important to get vaccinated? Separate the fact that we're recording, in late July, when we're about to hear that like indoor mask requirements are coming back because people are not, the Delta variant is spreading and people are getting COVID because they're not vaccinated. Like, how can we get folks to understand this importance?
For me, I like to come back to one word that which is freedom. It's a very American word because I actually believe that the best pathway to defeating the virus is by helping our healthcare workers have critical conversations with their patients in their community, eliminating the vaccine barriers, mitigating hesitancy, and talking about the freedoms that we are going to gain back when enough of us are vaccinated. That's the freedom from anxiety and worry and stress that I'm hearing. Actually, a lot of individuals and healthcare workers, when someone comes in with a bad case of COVID-19, they're being hospitalized, they are filled with this panic and stress of why didn't I get vaccinated? Why didn't I do it? Why didn't I protect myself? And we can have freedom from that. And right now I like having the freedom to boast about my strong antibodies that I've gotten vaccinated. But when we talk to even, I think the story I have on my team, we have a social media intern right now. She's going into her senior year at university. And the last, year, she wasn't with her friends. She wasn't there. She goes, I want the freedom to get back to having in-person class and going to football games and doing these things. And I really believe that getting vaccinated puts us on that path to getting our freedom back. And of course, helping our economy, helping our public health. So that's kind of where I like to start, is around this idea of the freedoms we can gain back by getting vaccinated.
That's the thing. I think, I don't think folks are realizing that like freedom is as American as apple pie, but also, don't you just want your life back? This is the thing. We went from being, I always use this as my sort of vaccine story about why it's so important. The week of February 12th through the 17th in 2020 was my last business trip. And on that trip, I went from New York to San Francisco to LA to San Diego, back to San Francisco, and then back to New York in 7 days. Because that's how my life used to be. I would get on from plane to plane to plane, go wherever I need to go, see who I need to see. And in between, stay at multiple hotels, go out for different dinners, go to Soho House, go to this, do that. I ran a Spartan race with thousands of other people in San Diego, and then came back. And when I came back, the entire world had changed. And today, the idea of flying from place to place, hopping from hotel to hotel, is just not something I can wrap my head around, because the world has completely changed. We can't do that anymore. And I'd like to do that again. It was fun. So I need everyone to get vaccinated so we can have the lives that we all led before back, but new and better, because obviously we can't go backward. We can only go forwards. But like the ability to bounce from place to place, not have to worry about where you're going, if folks are going to be vaccinated or not, and could potentially kill you. It's just not a thing that we want to live with for the rest of our lives. So just get the shot, please.
Your podcast is called The Reset, and you've kind of mentioned it here, which is we need a reset in how we look at public health and how we support our frontline public health workers. That is the mission of Sostento, is to strengthen those frontline health workers. And what we saw even before the pandemic, when we worked on the opioid crisis, and we've seen it even more here as we've worked with our free and charitable clinics, is that part of the reason we need to set this new standard is what we call a burden cycle on our safety net. And remember, for you to get back to all these things and everyone to get back, we need to get everyone access to this care. We need to get them vaccinated. We need to have them understand how they can prevent the spread. And so, these health workers that are on this safety net level, that are in these underserved communities, they already do so much with so little, and they are dealing with patients with have high burdens on their health. The social determinants of health for them, which are things like their education, their access to transportation, their community, their culture, all those other things, they were already burdened patients before the pandemic. And so they were putting a heavy burden on these free and charitable clinics and other community groups that they themselves were then burdened. And so they were in this burden cycle already, where they didn't have enough time and energy to give everyone the care that they needed. And these were the very individuals that needed the most care. And when the pandemic hit, I think we saw that burden cycle explode to many, many more individuals. How many health, for me, the deepest, darkest is that we couldn't even protect our health workers who were trying to protect us, that they didn't have the PPE they needed. They couldn't get people tested. And even early in the vaccine access was difficult. So I think to get back to these freedoms that you've talked about, understanding that we need a new standard in public health, and that's what Sostento focus is on. And I believe that we have to start in our most highly burdened communities and these overburdened health workers and disrupt that cycle. And if we're able to do that, I think we can find a reset and come back stronger from this post-pandemic. And I just want to do a little shout out to these free and charitable clinics that we've been working with. They serve families below the poverty line, the unhoused, the uninsured, the undocumented. There are 1,400 free and charitable clinics across the country. Before the pandemic, they served 2 million people annually. In the past year, they've done so many more. And I find that what's interesting about them, Laura, is that since they're not worried about profit motives, and they don't have the same government oversight, like government restrictions that say an FQHC or some others have, they're able to treat their patients like family and provide these culturally adapted services. And they've been in the communities for years. And if we want to talk about why people haven't been vaccinated in these areas, and like, who are they? How have they not been vaccinated? I have 3 words I usually talk about: translations, transportation, and trust. And to overcome those, you really need people who are embedded in the community, who have the understanding and the awareness of these issues to get these folks vaccinated. And I think that's a starting point for us to build back and to come back and set a new standard so we don't get back in this situation again.
I agree with so much of this. One, it's like, as someone who's daughter of a nurse, my mom was retired, but and lots of members of my family are nurses with Caribbean after all. These people have been busting their behinds for over a year, to keep you all safe. And then you see stories on the news where folks are in the hospital with COVID, and then they say, hey, you get vaccinated once you get out of here? No, I don't trust it. And it's like, do you not see the people who literally just saved your life, and you're going to tell them that the thing that's keeping them alive you don't want? Like, insanity. And the same, and then, with your 3 Ts, it's part of the reason why I created this Sunday Supper program, because, from the very beginning, even before it was for vaccinations, it was my idea to do it for COVID testing, because I thought the key was to bring dignity back to the experience, but also to make this be about the people who are there locally, because and you trust them. And whether you have 100 people get vaccinated or you get 55 people getting vaccinated, those people who then leave can go tell 1 to 2 people each, and then, hey, that's the folks who are going to go in next to get their vaccination. And it's just of paramount importance for folks to trust who they're hearing this stuff from. That's why with all this icky disinformation out there, at some point, there's going to need to be regulation, because there's so much of it out there that it's making, so many people who would normally and more reasonably trust, not trust. And then, getting people there. I go back to the beginning of the days when I was helping get PPE to communities that needed it. And folks would say to me like, hey, but everyone's got a mask. And I'm like, no, they don't. We live in New York City, no problem here. If you're in a small part of lower Arkansas, big problem.
Yep.
And stop acting like, take the privilege off of what you assume things are, as opposed to what they actually are, and realize that not everybody is the same. And I always say this thing that it could be July 2021 here in New York City, but it's July 1998 in certain parts of this country. And that's through no fault of the people who live there. It's just what's happened, whether there be infrastructure, whether it be internet, be it methods of transportation. And you can't blame the people who are in that. You can only do your best you can to help. And so that means, hey, pick up the phone and call in somebody because they can't slap you. Or yes, you need to fax this information over to you. Okay, we'll do it that way. Or yes, we literally need a mobile clinic because there's no Lyft or Uber out in the neighborhoods these people are. We have to understand, meet people where they are, and do our best to help them understand. But then give them dignity around it, whereby you're not doing them charity or doing them a favor. You're doing this because it's the right thing to do and you want to help folks.
I love the way that you describe that. And of course, the Sunday Supper idea is so powerful because it creates community, and it allows for what I think is most important to get these folks who haven't been vaccinated but are willing, and we could get them there, is a listen first approach. And only through that listen first approach can you determine what these little obstacles and barriers or even apathy is about. And so from the beginning of my career, my first job that we talked about, when I went out in the communities to do HIV tests, I failed at the beginning because what I did was the first thing I tried to do would go and be like, do you want an HIV test? Do you want an HIV test? And be like, I don't know you. I don't trust you. No, thank you.
Yeah.
But I talked to my community liaisons. I said, what am I doing wrong? And they said, Joe, you have 2 ears, 2 eyes, and 1 mouth. You need to start observing and listening twice as much as you're talking. And as I started to listen to the community talk, I realized a very interesting strategy to get them to take an HIV test, which was to screen football games. Everyone was football and soccer crazy, but no one had a place to watch the games. There wasn't electricity. It was only at the local bar. It wasn't, very community friendly. We did screenings of the games. Everyone would come, and during halftime, we'd do a little education, and people would get tested. And it felt like an uplifting community experience. And that's what I love about your Sunday Supper. And obviously that experience has led you to identify these barriers that really exist. And they're in some of these kind of rural areas, but even in urban, in Milwaukee, one of my favorite free and charitable clinics we work with called Health Connections, they are doing home-based vaccinations. They know there are a lot of individuals that either just can't come into their clinic, maybe are hesitant about coming into a health facility. So what they do is they send their health workers to people's homes to vaccinate them. And it's not like, oh, here's your shot, I'm leaving. They spend the whole day with them. They come in the morning, they check in how they're doing, they talk to them about the vaccine, they talk about their other health needs, they listen, they vaccinate them, they sit with them for the 15, 20 minutes to make sure that they're feeling okay. And they come back later in the day with a meal to be like, hey, are you feeling side effects? Let me check on you. That approach of listening, understanding why they weren't coming in, in, spread. And they're doing many, many of these home-based vaccinations because it's easy, it's simple, it's coming to me, and they have the trust of the community. And so your Sunday suppers, all those little things that you mentioned of things that maybe for us, we're like, well, there's a vaccination on every corner. How come people aren't getting vaccinated? In these communities where even like a factory worker whose English isn't their first language, they are recently immigrated to the United States. Well, I don't have time to take a day off of work. I can't, get off my bus route. I have to go in and out of work. And what about the side effects? I'm not sure about that. I need to get into work tomorrow. And you need to do these kind of very time-intensive interactions with these individuals to get them vaccinated. And that's why we chose to work with like the Health Connections group in Milwaukee to work with these free and charitable clinics, because they have volunteers, they have the staff, they have the time to really engage. And unfortunately, they've been a little under-resourced. Laura, I know you were trying to help me with this, but they've been under-resourced during the pandemic. I think they've just been overlooked because sometimes they're a little bit confused with the federally qualified health centers. They're confused with a walk-in clinic. No, these are volunteer donation-driven clinics that have a certain flexibility, and all the players are important. But I think if we're talking about these unvaccinated but willing that are left, our free and charitable clinics across the country are really well positioned to have the conversations, to create the right conditions and atmosphere to get people vaccinated. And that's why we're supporting them with our Project Finish Line initiative and just trying to mobilize for them the funding and tools and services that they need to get these, what I call the coalition of the unvaccinated but willing, to get them to get their jabs and get us closer to that pandemic finish line.
Yeah, I mean, you just have to do what you need to do, and but remember where folks are. And that's the key about it. And I think, like I said, someone was like, why don't they just like DM them on Twitter? And I'm like, do you think they're on Twitter? Like, what planet do you live on? I mean, and here's the thing, like, I have no public health background at all. What I do is move mountains for a living. And so, like, it's the same premise. And my whole thought was that I was seeing a lot of these organizations, and I'm like, really lovely people who want to do good, none of them who look like me. And so I'm like, oh, I see what the problem here is. Y'all are such do-gooders, but don't realize the deal. It's like, and it's not like we're not similar. We're probably more similar in our upbringing than I have with someone who's from, somewhere in Milwaukee, for example. But I might look like that person.
You know what? In the nonprofit world, one of the hardest things to deal with are folks that are doing the wrong thing for the right reasons. It's one of the hardest things to overcome, where an individual does have the right intention, but you have to talk to them that their approach to the solution without empathy and time to listen won't work. And sometimes you just have to let it happen. Again, one small example of in Alabama, in a very low vaccination community, how we got people vaccinated with the medical outreach ministries, another free and charitable clinic in Montgomery, Alabama, is we're like, well, let's run a survey first. And we had a short conversation survey that they could do on paper or do online on their phone when they came to the clinic, or we saw them in the community. We said it was a vaccine attitude survey. That was it. And we had got about 250 folks that filled out that vaccine survey. And we saw there were about 50 of them that said, I'm unvaccinated, but I'm pro-vaccine. So what did we do? We had one of the volunteers call those folks. And you know what? They just had a few last questions. They wanted to talk to someone. Maybe they needed a ride scheduled. They all came in and got vaccinated. And sometimes it's that simple of like, well, let me listen to you. Well, what are your attitudes about the vaccine? And you find that there are these folks that are willing, but we haven't approached them in the right way. We haven't taken that, and I know it's harder now. The mega sites aren't going to work anymore. These are people who don't have their own vehicle, that don't have insurance, they're worried about the costs. And sometimes it's just it's not what we maybe from, like you said, people with different life experiences think the solution is. It's having to listen and just engage, understand, and then figure out what approaches might work.
Yeah, I think that the fundamental thing for folks is the ability to listen is not an inherent skill set. And
yes.
I think it's something, it's funny, like the show Ted Lasso, like I finally gave in and watched it a few weeks ago. And I was like, this should sort of be required reading for all white people. Seriously. Because he says the thing that you all know that folks never say. you have to be curious and you have to be kind.
Mhm.
And the curiosity part is actually the empathy thing.
Mm.
Because if you can come at it with, like, I genuinely want to know, the I genuinely want to know is a form of curiosity. But the flip side is, because you actually want to know, you are showing a degree of empathy. And then the kind part is really important. And that I don't know what you're going through, but I can at least be kind to you.
Mm.
We make this joke about New Yorkers that, like, um, New Yorkers aren't nice, but they're kind. Where, like, a New Yorker might be like, you might ask someone for direction. They might, what the heck are you talking about? How do you not know there? Give me your phone. Let me show you the directions. Because it's like, I'm going to take the second step of, like, trying to help. I might not come up to you the nicest way and, like, be fake, nice and fake to you. But I'll be like, all right, I cannot believe you don't know where Times Square is. Like, here you go. But that's the same thing that we have to sort of deal with when we're thinking about how to work with communities that we don't normally know. That genuine curiosity, so it allows you to listen, it allows you to listen with empathy, and then to be kind about, like, how can I be helpful? But if you don't start with that curiosity
Yep.
and empathy and saying, like, how do you not know? Like, literally the reason why this whole thing actually started for me was I spoke on a panel, and I said on the panel, I was like, listen, my DMs are open. If you ever want, like, some advice on marketing, yeah, DM me. And a college student DM'd me, and she happened to be going to school in Arkansas. And we started chatting, and I
Yeah.
was like, so wait, how are things going on down there, like, COVID wise? And she's like, oh, well, our school never closed. And I was like, what do you mean? Well, we're in a red state, so if they close, we might lose our charter. And also, this is one of the few safe spaces for a lot of these kids living on these campuses. They don't have a home to go back to.
Mm. Mm.
And I was like, wait, do you guys have masks? And she's like, no. And I'm like, oh my God. I like, is this a common thing among these smaller HBCUs? And she's like, yeah.
It's a curiosity to understand the problem and not lead with the solution. Like, and you go down that rabbit hole. Even for us, like, we know transportation is a barrier for these unvaccinated but willing folks, and we have been working to use rideshare program like Uber to get them rides. But you have to keep being curious, because, well, these individuals don't have and never used the Uber app before. They're afraid to put a credit card, or they don't have a credit card to put on it. There's a technology barrier to using it. So then you have to keep being curious. Okay, there's a way for these free and charitable clinics to order the rides for them to use the Uber. However, we kept interviewing, and we found that a lot of individuals who have never used a ride share, remember I talked about trust. Well, I don't know whose car that is. And for them, they would sometimes say, well, where's the taxi sign on this car? I don't know who this person is. Are they a registered taxi? That they didn't understand it. And that they didn't trust it. And so you have to keep, like that story you told about the student in Arkansas, was you kept wanting to have empathy and really keep peeling back the layers of the problem. And at Sostento, we talk about listen first. And really why we do listen first is when we can solve the root of the problem, we create the sustainable solution that the local community can take on themselves. And so that story really inspires me. I love when people take their business experience. I have so many work I've done with business leaders that once they get that curiosity about the problem, and they realize that their experience will come into play, but in a totally new and different way, they're able to work and empower communities themselves to take on the problem, which I think Sunday Supper is like another great example of you choose the food, you support your local businesses, bring in the food that makes sense for your community, and run that event and get people to come, give them a meal to go, and talk to them about the vaccine. Like, that's a solution that understands the problem of needing to amplify the health workers' voices, giving them opportunities to bring the community together of these unvaccinated but willing folks, and show them that we care about you. And we care about you, not just, oh, I'm here just to vaccinate you. I mean, when we talk about, structural racism and historic mistrust, if you come in and you go, hey, I'm here to vaccinate you, just like I did at my first job, and say, well, they said, well, were you here for the gun violence when I needed you? Were you here for the diabetes problem? What about the drug overdose epidemic? But now you're coming and asking me about this one specific thing. I'm skeptical. And that's why it's so important. If we want to get to these unvaccinated but willing folks, we have to start with the listening part. and the curiosity of what the problem is and what the barrier and what the hesitancy is about. And I think if we can help our medical professionals to have these conversations in settings like Sunday suppers, we're going to finally end the pandemic. And that's what we're trying to do at Sostento with our free and charitable clinic network. And I think it's possible. I know it's possible. We just need to drown out the noise and not make it a debate about mandates, because that's going to cause everyone to run back to their corners. But really just talk about how do we get this last mile of these individuals that are often, and these health providers that are overlooked and overburdened.
It's so true. That's where we have, because we're breaking our healthcare system. It's like right now, we're training our next batch of doctors and nurses, and they're walking into a pandemic at jump. That's not going to be sustainable. And so we have to do what we can to help as much as we possibly can by getting this word out to all the folks and be like, listen, y'all, just do it.
And I think that's the number one group that wants to see this pandemic over our frontline health workers. They have been tired and demoralized and not taking a vacation for 18 months. And that's why, for me, I stay out of, if someone wants to spout myths or conspiracy theories, I don't give them the time of day, because I believe that by trying to debate them, we're actually doing a disservice to our health workers, because we raise their profile. What we can do better is to amplify our health workers' voices, support them, volunteer, donate to our local free and charitable clinics, so that they can have the capacity to have these critical conversations that's going to get our public health back on track, which will get our schools back on track, which will get our economy back on track. And I think that's what we all want. I know that's what I want. And I know from what you've told me, I want you to get back to your Sparta races and all the amazing events that I know you were running before the pandemic started. And of course, in a new and different way, but really probably educated, inspired by this journey you've gone on through the C19 Coalition, the Sunday Suppers.
Yeah, it's interesting. I mean, I think we've all been invariably changed, and I think because it's funny, because the thing that's going to change now actually is that we're all different. We've all had a collective trauma, and the mental health aspects around that have changed everyone. And I think as we get through getting people vaccinated, we also have to remember that one of the things that we're going to be starting to offer with some of our suppers is mental health professionals there, because this has been terrible. I think nobody is the same. No one is a happy-go-lucky joy of joys. We've all been invariably changed, and we have to acknowledge that as part of our recovery as we reset and go forward. And because if we just say, okay, you got your vaccine, go back to working your 18-hour a day shift, yeah, not gonna happen. Even for me, when I say as fun as that was to fly from place to place, I'm like, yeah, I'm probably not gonna do that. I might do one, but I'm not gonna do 4 in a week ever again, because that's where you get to lead to burnout. And how can we do things a little bit differently, more efficiently? Maybe those aren't live, maybe those are virtual. And so, and for our healthcare workers, how can they, get some assistance? Because seeing all that trauma and death and having to deal with people who didn't want to believe what was in front of them, that's an enormous task that you've put upon people. And so the collective mental health of this nation is also going to be a thing from a public health standpoint that needs to be has to be addressed in smart and intelligent ways, because that'll create a whole other pandemic if we don't.
There are a few moments in my career where I'm like, oh, this is like universal humanity, something that everyone has experienced or can agree on, or and I think the pandemic has been the largest one, where no matter where you sit, no matter what community you live in, the pandemic has touched your life and helped you realize how important it is to improve the public health of everyone. And never have we ever had, I think, a simultaneous human experience like this in my lifetime, at least, where anyone you talk to around the world can talk to you about how they've been impacted by it, how it's changed their lives, and why they know that we can't go back to the same way it was. And so I think that's the opportunity here, is for us to have a level playing field and realize that, I've done some work in India, and someone said to me there, when I would say that the measure of a society is how we treat our most vulnerable. And I think the pandemic has showed you that right now we are not equipped to serve them. And
Nope.
if we don't serve them, then business owners and people from the middle class all the way up to the, the wealthiest that rely on the economy doing well are going to suffer. So this is it's a level playing field. It's why we need to invest in, our frontline health workers, strengthening the work they do, breaking that burden cycle of not having enough time in the day to serve the patients who have too many chronic health conditions. We can do interventions to change that. And if we do, we're going to change that to a hope and opportunity cycle. And that hope and opportunity cycle will really change the future of, how we all look at our health and how we're able to grow together to create a healthier society. So that's the opportunity moving forward, because none of us want this to happen again. I know there's no one to be like, yeah, I want this to happen again. No, nobody does. We learned, we can find the silver lining, but none of us want to go back to what it was like when we were, lost our livelihoods. We couldn't leave our homes and we were worried about our loved ones. We can all agree we don't want to go back there. And so let's set a new standard in public health and let's change the way things happen in the future.
Absolutely. And so thinking about all of that and all the work you're doing, incredibly stressful. What in the world do you do for your self-care, Joe?
So I love to garden. When I was in Africa, it is slower there, slower pace of life. And I was in a rural community and I was learning, and I said, I want to learn how to garden. And they go, you mean farm? I'm like, no, just like garden a little bit. And so they laughed at me and they taught me, which they said, here, you dig a hole, you fill it with fresh soil and some cow dung, you plant your seeds, and then all it takes is love, water, and sunshine. And I've brought that back. I've become an avid gardener. I'm, getting pretty good at it. And here in New Jersey, where I live, it's the garden state. So I guess I'm living in the right state. And I love being in the garden, working with the plants. They don't talk back to me. They have their own story for me. But that is how, when I'm looking to relax, I go out and enjoy some time in the garden.
What are you growing in the garden?
So the other day we had some string beans. We had 3 or 4 different types of tomatoes, 2 or 3 different types of peppers. I have raspberries, strawberries. I always try, some spinach. So yeah, a little bit of everything. We've had a lot of rain. Which has been good, but too much rain also isn't good. But
right.
Overall, I've been enjoying that. And that's my mental health savior. When I, to make sure that I'm doing that balances me.
Oh, wow. I mean, okay, that is a first on 200 odd episodes of the podcast for someone to say, especially for a man to say that. Awesome. I think that's fantastic. Like, you got to do what you got to do. And if you want to have a farmer's market in your backyard, I'm all for it.
It's very rewarding. You're never going to have a farm out of that, like I said, but it is quite a rewarding process and very calming, grounding. It's a very grounding experience.
Yeah, you're with the soil and you're in that natural air. Is just awesome. So very cool. And so last question for you, sir. Do you have a give and or an ask of the audience? And I'm sneaky suspicion I know what this is, but do you?
Yes. So everyone can go and check out our project to vaccinate 1 million under and uninsured individuals in these communities that I've spoke about, that we're working with the free and charitable clinics. You can go to covidfinishline.com. Again, it's COVID finishline.com. And there you can learn a little bit about our initiative. And basically, I would suggest you look for the free and charitable clinic that is in your neighborhood or in your community. You can donate to them, of course. You can also volunteer. One of the things we do with our free and charitable clinics is we set up volunteer call centers. So if someone calls in about the vaccine and has a few questions and no one has time for it, you could be trained to actually have those conversations on the phone with them and help them overcome their hesitancy. So yeah, check out covidfinishline.com. Look for your local free and charitable clinic. You can donate, you can volunteer, you can amplify their story on social media. So that would be my request of all the listeners.
Awesome. That's a great request. We'll put those details in the show notes so folks can find you guys and donate and maybe potentially volunteer as well. Well, Joe, as I thought, a fantastic conversation about the way the world we are right now And I love your passion. And I think that we're going to get there. We're going to find a way to get these folks vaccinated. So thank you for all the incredible work that you're doing.
Thank you, Laura, for hosting these conversations and helping us realize that we can come back to a new, different normal that's going to be better for ourselves and better for our community. So thank you so much.
Awesome. And that is our show.